Hey guys, welcome to my channel. No, I'm just kidding.
Hey guys.
Don't forget to hit the subscribe button.
So you have all three in there, so that when you do that, you can just
See, look at it coming out.
yeah, all milky.
Okay, yep. See how easy it is on my shoulder? Otherwise, you just go straight lipo, it's hard to pull off fat. And when it's a liquid, it comes out like a milkshake. Definitely brings the boys to the yard.
I knew you were going to say that.
Yeah.
I don't even know if she might be too young for that song.
She doesn't know it. She was born in 2006.
That's probably when that song came out.
Milkshake?
Yeah?
I know that song.
Oh, okay.
Milkshake brings the boys to the yard?
Yes.
Do you know who sings it?
No.
Khalees, I think is how you say her name.
There's a really funny guy. I think he's like, not bad dad, but another dad. He was recording his little girl in the back seat. And she had a milkshake.
Good morning, Miss
She
Haley.
was like 3 or 4 or 5 and was like singing, "My milkshake brings all the boys to the yard." He was looking and he goes, and you just see the milkshake get thrown out the window.
Oh
by
my
the dad. He
gosh.
goes, "Your milkshake ain't doing anything anywhere."
Oh.
Not bringing nobody nowhere.
Yeah, ain't nobody gonna give you no milkshake anywhere.
Well, also they like my daughter knows the Who Let the Dogs Out, and that's pretty old.
Yeah.
She was born in 2011.
Yeah, I don't know. Music had like an animal phase at one point. Who lets the dogs out? What does the fox say?
Oh yeah, that's true. Forgot about that one.
Hey, Siri.
Hi Nancy, hi Olivia, thanks for joining. Good morning, almost afternoon. We are live here in San Antonio, Texas with Dr. Jeneby. We are on our third case of the day. First case was a facelift neck lift. Second case, she did a removal and replacement of her implants with a lift. And this last case is a BBL. She's doing lipo 360, so lipo the front of her body, the back of her body, and then we're taking the fat and putting it into her butt to give it a nice rounded shape. If you guys have any questions at all, please feel free to drop it here in the chat. I am also going to pin to the screen
Milkshake brings all the boys to the yard.
the form that you can fill out if you're interested in filling out the form for booking a consultation, learning about financing, pricing. You can fill out that form, and I can pass it over to members upstairs.
Can you play my milkshake brings all the boys to the yard?
You know what, Tracy? I think he is. And when he does go live, I'll hop off here so he can go on his. But I believe she's yes to all. I don't think she started her surgery yet. Sorry, I'm laughing at his music choice. I will text and ask though, because the other social media team member is over there with him.
Can you just grab this light on the outside, not the green, and move it?
Hi, Tobes. Tobes is on, Doc.
Tobes, thank you.
Tobes McGobes.
So, liposuction is super boring. Not really an emotionally satisfying operation. Mostly gross movements, not like a face or a right or a left. So you've seen a lot of things today. So there are.
When you do a tummy tuck, how do you avoid
Oh yeah, when you go.
Yeah.
That's a,
Oh, you didn't see any today.
You cut it out and then you anchor it down. And then you pull the skin down to meet it for an inch. Everything yours, damn right. I can teach you, but I have to charge.
I haven't heard this song in a long time.
That's the other surgery center.
So, Mrs. Haley, so we will, what we'll do, what procedure are you interested in having done? And I can give you a better idea. And will you be driving or flying?
1 minute. Blank. One.
Warm it up.
What if there's my milkshake radio station?
Does it say the year on there, Dr. H?
Huh?
Does it say the year it came out on there or no?
I don't know.
I'm gonna guess 2009.
Probably. Look that up.
Elise, though, right? Is that her name?
So, yeah. It was the funniest thing. My milkshake brings on in this little girl. He's like, Calais.
You said you did CrossFit.
I do.
Would you ever do Ironman?
No. I'm not built for an Ironman. I'm not built for speed.
Or like high drops?
I'm not built for that.
Oh, dang. 2003. I was way off.
When I was 22, I was lifting pretty heavy CrossFit. I was like trying to compete as a senior, which is not RX.
Lipo 360 transfer to the butt and breast reduction. Okay, and then would you be flying or would you be driving?
But she's answering the question.
It was 2003 that it came out.
Not gonna take me a surgeon. Flying all the time.
Yeah,
Almost
that's
like a TV show. Yeah. That's how you found me. Right?
Yeah.
From TikTok?
From all multi-channel.
I found him from a billboard first, and I was like,
Oh, yeah.
and I
That's
was
my
like,
man
there's no
right
way.
there.
Yeah.
Like, I want to go see him. And John actually said, no problem. He came to me, he goes, this Mexican wants to work with guys. I said, from what school? Like UTSA? Because I already helped those guys.
Mm-hmm.
They're like, I don't know. I said, okay, that's fine, whatever.
Did you email or you called or?
I did both. So usually I call, and then they tell me to email my information. But I always have the same script every single time I call someone.
There you go. I mean, why?
I'm pre-med student from the University of Incarnate Word, and I was just wondering if you guys had any shadowing opportunities.
Now, anybody wants to follow me from your class, they go to you. You're my
Yes,
Okay,
consigliere.
so Miss Haley,
You're
so
my consigliere.
lipo 360 to butt
And you have my
and
phone
breast
number.
reduction.
So then,
You're
I
the
feel like I
same
have a phone
thing.
number.
Let me double check. I don't think.
Yeah. So
Oh,
then,
cool.
yeah, it's fat. So then, when somebody wants to do it,
Give me one second.
you're
He's
gonna
finishing. He's
text them to show up here at 5 a.m.
Yeah.
Or just like you did, and black scrubs. And I'll take care of the rest. But just give me a heads up.
Okay.
Because I had a girl like that at AMSA in UTSA. They went through her. So you see, I'm not giving you his phone number. You're the only one that gets it, because you were the first. And you're the El Presidente. So now you wield the power.
Yeah, that's why I was asking if he would be okay with students too.
Thank you for the follow, S. Martin.
We'll all be okay.
Oh, that fell on the ground.
Uh,
I'll grab them.
no, it's alright.
Okay.
No grab, no grab.
No, not. I was saying grab them to.
They'll come and get it.
Okay. Lipo 360 with the BBL and breast reduction. She's coming from Georgia to Texas.
Step on it.
Flying, still 2 weeks time, right? Dr. J? And she's coming from Georgia, but she's flying. Lipo 360 with the BBL and breast reduction, still 2 weeks, right?
I like 2 weeks because we want to see what's happening with you.
Thank
We
you
want
for
to get you in
following,
your
Susan.
first and possibly second stage tournament. We want to get a couple massages in, possibly. And we also wanted you to be, for airline flights, you get more clots.
So we'll give you medication when you're flying before a flight.
Yeah, Lovenox.
But he likes to say
300
2
upper
weeks.
ab.
It's the safest amount of time. He really prefers longer, but we understand it's not
FAA
ideal.
says 3 months.
Yeah.
So we're really pushing it 2 weeks.
But it's best to wait 2 weeks so you can get a couple massages in. Just make sure everything's going the way it should be, and then of course to reduce the risk of clots. And Dr. J let me know a couple weeks ago the clots don't happen while you're in flight; they actually occur after, potentially weeks later, right? Clots from flying. So, thank you for the follow, Susie. We do, Haley, but it's always different. It's hard to say. Like, we have our standard prices, but it's hard to say because let's say you come in for lipo 360, but then you want to add a little extra lipo to the arms, or someone wants to add lipo to the inner thighs, or they don't just want the front sides and back of their belly. They also want like a little bit on their thighs or their saddlebags, or and the same thing like breast augmentation. Do you need a breast augmentation with the lift? Are you gonna go, do a donut? It's all kind of like different. Same tummy tucks, or is it a mini tummy? Is it an extended tummy? So it's best if you fill out this form and then tell the team members exactly what you're looking for, and then they can build a price for you. We also have a pricing estimator in the link in our bio if you want to fill that out and get an estimate. However, that doesn't always include the specials we have going on, so it's best to speak to someone directly. Okay, she says, what if I drive there?
I mean, you'll be fine if you drive. It'll still be a long trip home that 1 week. But
And you'll have to sit on your pillow and...
Samples were sent out, patient went out great, went over instructions, talked about the switcheroo.
So you would probably just, I would just
Yeah, 'cause
say
he
maybe
would have
2 or
looked
3 days
terrible.
at that point.
Yeah, no, I agree with you.
Like, we call audibles in the OR.
No, I agree.
Call an audible.
My only
Yes,
concern
yeah,
was that
that's-
since we write
Haley,
it
that's the
in,
best option
and they
because,
initially going
again,
in,
like
that's why I was like,
if I wanted to get like the 360, I would want to do like the 360 with chin
Yeah, you
lipo,
just make a
you know,
straight stripe
and
through that.
so it's a little bit extra.
And I put a
You can fill out the thing on the link in the bio,
No,
the
that's
pricing
great.
estimator,
Let's
but
make
then
sure we did all
it
that.
doesn't put in any of our discounts or
CYA,
anything like
baby.
that.
CYA, baby. But it actually looks better the way we did it.
I think it does too.
200 lower abs, 100 bonds. I dropped those vaser. The med student made me do it.
All her fault.
Today's our meeting, right? She'll have to time at it.
Yeah, I was doing reports while you're
Okay.
waiting for you. I'm almost done. I'm just doing the organic lead count and I'm done the
Yeah, and
reports.
also we can look at our Facebook data for now.
I pulled it. So we have 5 so far. We're under $14 a lead though.
Oh, where are they going to?
They're going to GX and I'm checking
Oh,
them.
they are?
Yes,
They made it all the way through.
I made sure. I've been checking them.
Good.
Do you need another vaser for now or good?
When to flip.
There's only 5, which I was hoping for a little bit more, but that's just
So it's 14 a lead. It's average for us between 11 and 20. The Omen deal is right at about 11. The breast offs are 17.
okay.
We're
And this
pretty
is for
good,
this is
actually.
for lipo, so
Yeah.
it's a little under 14. I think it was like 13. I have it in my notes, but and then
So you saw the leads in ours, what?
in her
Ours
Facebook column,
nice.
and then
Now
the
we can see if they, now we can go over, we can go to next second and see if they book.
okay, yeah, we can look. It hasn't been running a full week, but we
Another
can.
thing is, you can go to GX, copy those names and say, have these patients booked. They came from Dr. Ayers Lipo.
Who would I ask?
Finance group.
Okay, okay. I thought you meant like
You
I
have all
could.
their numbers?
Yeah.
The finance group? Say, hey, we've got our meeting today, can you tell us the disposition of these people? Or you go into GX and see what's happening with them.
Okay, because there's 3 from the ad A, and there's 2 from ad B. B was the new girl. I mean, sorry, B was
Tax, one's Valentine, one's tax.
no. These are both. This one campaign A/B testing for tax, and then I have the Valentine's Day one working. You want?
We'll look at it.
Okay.
What did you have to do for Velma? Download TSS scan again? Because they had an update, right?
That's what I thought was the second option, but I told her let's just do a hard reset. We'll unplug everything and not restart. We're gonna shut it down and then
Yes.
start it back up.
We did do an update this morning.
Okay, so maybe that's
I
why.
had wanted to see if Adobe Acrobat Reader had an issue.
I thought it might be an update issue too, but we just reset or hard
Sometimes
shut
it
down.
does.
Yeah. I said unplug it,
Sometimes you
60
just
seconds.
Unplug it, put it back in.
Blowing it.
Wave a wand.
Yeah.
And
She
it
was
worked.
like, thank God, yes.
So now she knows at least to do that.
Well, she said the girl in Next Tech told her to restart it, and I was like, no, you need to shut it down. Because it wasn't letting her restart because that program was still showing open. So,
But it's good for her to get to know next tech too, so I'm not being called.
Mrs.
On a break.
Haley, do you want to put your email in here, and I'll email it to you? Because on YouTube it's a little bit different. The form doesn't pop up on the screen.
Can you tell everybody I need another metal ring to go out there?
If you drop your email in here, I'll email you the form. Thank you, Yvonne, for the follow.
Yeah, please. Thank you for your help. All right, Doc, right flank. Looks like, what did I say the upper and lower were? Oh wow, 500.
Are you trying to fill up the whole thing?
Whatever she gives us.
How do you know when this stops? Whenever it
What you
stops
pay me
being
for?
going?
Do I look, I feel, if I can pinch it, it's just skin. Alexa, can you play Depeche Mode radio?
That was
This?
an unfair one.
This one I heard, no?
Ah.
Jesus. I just.
Bananas.
Go home.
I almost
Yeah,
got
I need to go home.
Take a look at this type of ring.
That doesn't come out.
Are you hiring surgical techs? Someone's asking.
Yes, for Maximus.
For Maximus, we are. That's our surgery center across the street. If you want to contact, you can pull up their phone number and call them across.
Me?
No, he's talking about surgical tech,
Oh.
short-term memory.
You know, Hernandez never talks shit.
Can you read this in Spanish, please?
It's like he ever been a
Una pregunta o una question. ¿El doctor puede hacer lipo si tengo una hernia en el lado derecho?
She's asking if you can do a surgery, or if you can do lipo if she has a hernia in the abdomen.
Depends on where the hernia is, like umbilical or ventral. And has it already been repaired?
She said on the right side. Lado derecho, that's right side, right? Yeah.
Yeah, but has it been repaired? How does she know? Does she have a CT scan? Has anybody worked on it? How does she know she has a hernia? Who's telling her this?
¿Cómo te sabes cómo tienes el hernia?
I'm about to finish my own shit.
See, she responds.
Yeah, sometimes it's silly.
They told me in Mexico. El doctor?
Oh, I was going to ask you, it really did 200?
Yes.
Wow, I really thought it was going to be 100 or less. Good.
So I opened it.
So here's what happened. Right around, everything was fine, and then she moved on to her left lateral cube and dropped her EP just once.
Me dijeron
Why
en
left
México.
lateral? You
Pero
almost did right lateral.
un doctor se dijo.
IDC, yeah. But she moved, maybe she had a bagel. Because she was rock solid, but then
Un doc después que
But he said right around.
hold on. Un doc después de que sacaron la
Haley, for your question, the breast reduction most of the time will include the axilla lipo, right?
Breast reductions do sometimes, depending on how much you have. They will during your pre-op, they'll determine whether it's part of the breast or part of the armpit. If you have to get more on the axilla to make it look contouring, or if it's just part of the breast itself.
Your filter looks pretty.
Oh wow. Oh, she had her. They told her after her gallbladder removal that she had a hernia on the right side.
It could be a hernia from the incision, or it could be a real hernia on the abdomen. So does she have a CT scan, or does she want to come in and be seen? If it's upper abdomen and we don't know, then we may have to avoid the upper abdomen. And just go lower.
Si tienes un, ¿cómo se dice? Examen de CT, si puedes traer en el, cuando vienes para ver al doctor y puedes habla de preguntas a él. Porque él va a necesitar hacer un assessment a ti. Si puedes, si van a hacer. Si puedo, si puedo decir. Sí puedo, después te lo digo. Ok, gracias. Ok. Yay.
Doc, when doing the breast reduction, she was asking about armpit or side lipo. If it's required or it's suggested that we do it,
400,
is it separately priced?
Breast reduction, armpit, or side lipo, usually there's a small little charge for that.
Okay, there's a small additional charge for it.
But not a lot. Not if you just didn't have the breast reduction. It's kind of like an add-on price instead of a
But I don't know right now what that is.
No, I didn't. Yeah, I told her to do the pricing estimator and talk to
The
the.
next thing is, well, how much?
Yeah. No, she filled out the build my body.
Yeah, okay, good.
Yeah.
So this. Hello? Okay. Did you tell Boo? What is the lab you need? Why don't you just go to CPL? Let girls will do it for you. So it's 1203. Did you talk to the manager? You need to definitely tell Boo, like, come on. We can understand. Just text him right now. Why? He needs to know. So when are you gonna go back? Sorry that happened.
So the team members will tell you if we're having any specials on their end, like financing specials. But at the top of our pages, we have our specials pinned for the month.
That's like the windows, and I forgot that this was like, you know, like, oh my god, it's gonna storm.
No. 1.0 doc upper.
They do, yes. Lipo 360 is included in the Super Mommy Makeover.
Oh.
Plasma. Plasma's the fourth state of matter. Liquid,
And that's
solid,
like tightening it.
gas, plasma.
And that's tightening it.
Yeah.
Because of the fat gone, there's the separation of the skin and the fat loss, right? There's no more fat there, so.
It looks like one of those electric lighters.
Like a Tesla. Tesla coil.
I've never seen it before. Honestly, I drive
You
around.
probably have if you touch one of those weird things that you put your hand on and it
Oh, yeah.
goes toward
Oh,
your
yeah,
finger.
yeah.
That's based on a Tesla coil.
Oh.
What kind of labs did they do before surgery? So if you're
Depends on what your
healthy,
issues are.
yeah, if you're
Your age.
if you're healthy, if you're
You're healthy, young, under 40, no medications, just a CBC. If you're got more stuff that we determine, CBC BMP. If you have thyroid, CBC BMP thyroid.
wrap. You said wrap, right? Ask him too. He might want.
No, I'm good.
Oh.
Feed everybody else. I don't need it. Feed everybody.
Put it over there, 'cause nobody got, he didn't bring any either.
Who?
Chef.
No, I told him not to do Chrysalis, not Maximus.
He did everybody?
Well, now people can see what it's like.
We'll be okay, we're good.
All right.
We're back up.
Thank you. Will you put my name on it, Justin? Thank you.
This is blood.
Oh.
Well, you're just telling her to have them give you Chick-fil-A. That's why I was saying.
We had a guy from a bank order Chick-fil-A. I told James, no lunch for Chrysalis.
Is that his name? I never knew his name. The meal prep guy? James.
1.5.
Well, hopefully it's
Hey
not.
Alexa, flock at Seagull's radio.
Hopefully it's not Steak Jose again. Whatever it was.
What'd you say?
The Steak Jose. Remember, that's what it was yesterday. That's what he called it yesterday. Steak Jose.
No way. I actually
No
told
way.
him, but she was real nice. I'm like, wasn't your best dish and it wasn't a mega hit. How about try something else?
It was just odd, you know.
Listen, it's
It actually
hard,
didn't
it's hard
taste-
to feed people for 30 days.
It didn't taste bad. I thought it was good. But I think it just threw people off because they didn't know what it was and what it was called. So, but I'm always grateful for whatever.
Yeah, no kidding. I mean, some of them he hits home runs,
I really like his taquitos.
0.5 Mons.